Good afternoon, folks. Daviess County Judge Executive Al Mattingly here with our weekly COVID update. Before I get started, I'd like to let you know that this is one of the last times that we will be doing a COVID update. Next week, I plan on having Clay Horton here. Clay can answer any of the statistical questions that you might have, where, what, why, and when COVID is going on in our community and the Green River District. Then that's on the 2nd of June. On the 9th of June, I'll have Dr. Dufresne back, and Clay and Dr. Dufresne both have been regulars on this update. Dr. Dufresne will be here talking about the medical side of COVID, what happens long term, what are long haulers. He'll also be talking about breakthrough cases that have been seen here locally, as well as any of the information on new vaccines. So on the 11th of June, if you recall, that's when the governor has decided to open the state up 100% capacity and remove the mask mandate. Now, there are some exceptions to that. One of them will be if you go to the hospital, you're still going to be required to wear a mask. If you visit someone in jail or prison, you'll still be wearing a mask. So, but for the most part, we will be back to normal as normal can be. So after the update on the 9th, my plan is to do a monthly update that could include COVID, but it'll also be talking monthly, kind of like the old Speak Up series, where we would come online and really answer the questions, any of the questions that you folks might pose about any issue that's going on in the county. It will also afford me an opportunity to bring guests on who might be new to the community or who might have information that would be of interest to the community. So let's get started. Today, Daviess County reported 10 new cases of COVID. And that's still relatively good because that keeps us in the yellow. And I'll get to that in a minute. We've got 3 folks in the hospital. We show 184 deaths. Unfortunately, that's +1 from yesterday. We reported a COVID death here in Daviess County. So I'm going to ask you just to pause with me for a second and let's remember those families of those folks who have died from this terrible disease. We have had 10,611 confirmed cases. If you see, there's the recovered cases say 9,641. The difference is about 1,000 cases. That is not a true figure. That's probably closer to 100 or 10,000 people who have recovered, 10,000 plus. But because there was an error that was in there from the very beginning, that's off just a little bit. The Green River District Health reported quite a few more cases today than normally because the cases were up in Henderson, the cases were up in Webster County. I talked to Clay a couple days ago about that. Sometimes it's because there's an outbreak in jail or perhaps an outbreak in a nursing home, and he said it was just general spread that was occurring in those communities. Now that tells me that COVID is out there. COVID is still a concern. The best tools that we have to fight are masking, social distancing, washing our hands, avoiding large crowds. But remember what we talked about. We added a tool to that toolbox, and that's called the vaccine. And probably that's the best way to protect yourself and your family is to get vaccinated. There for a while, you had to be 18 years of age or older to receive the COVID vaccine. Now that vaccine has been allowed to be used on those who are 12 years old and older. And I think that's the Pfizer. And I think I saw where Moderna was asking for emergency use of their vaccine on those folks who are 12 and up. The governor has reported that one of the fastest growing age groups for COVID cases is the 20 and under folks. We've almost seen very few, or we see very few folks now in that plus 60, plus 65 category with COVID, simply because we have done a really great job of vaccinating them. Jordan, pull up the map that shows the cases per 100,000 across the Commonwealth, if you would. All right, so there is a map, and it shows the rates per 100,000 in the various counties. If you look, the state's overall current incident rate is 7.01. That means across the state, we're doing a really great job. In Daviess County, we are down to 8.6. And just a week ago, over the weekend, we kind of broke in and out of yellow. I think we're solidly in yellow. Now, a bad day or two up in the teens could bring that back into the orange. If you look to the west of us in Henderson, Union, Webster, and McLean, they have popped back in the orange. They've been in the yellow for a while, but they've gotten back into the orange. Good news is we show three counties that are in the green. We also show 26 in the orange and 1 in the red, and that's Owen County up just east of Oldham County. But 90 of our counties are in yellow. Now I went back into early January, middle of January, and looked at this same map, and it was 100% red. So to go from 100% red to where we have almost 90% of our counties in the yellow is really an indication of what a good job you folks have done in wearing your mask and social distancing and getting vaccinated. But again, I can't emphasize enough what getting vaccinated means. Let's go to slide number 4, Jordan. Right now, the percent of vaccinated population 18 years of age or older in Daviess County is 49.18%. Now that's up from about 43%. So it's really we're moving. It's slow, but we're moving. I want to compare that to our Webster County to the west of us. They're at 37.08. Robertson County, a very small county up in eastern Kentucky, has about 2,500 folks. They're only at 27.72. So you're wondering how it's such a small county, why they don't have more folks vaccinated. And the answer is, I don't know. But what you will see is Robertson, I've seen them go from green to yellow to red, back to orange to red again. So because of their small population, it doesn't take 1 or 2 cases. Boone County, our sister county in northern Kentucky, has vaccinated almost 65% of their folks who are 18 years of age. This is on comparison to the state average of 56% of those who are eligible have been vaccinated. Let's look at the plus 65, Jordan. We're doing a good job with vaccinating our older citizens. Those who are 65 years of age or older, 76% have been vaccinated. That's one of the reasons we see smaller numbers of COVID incidents in the older population and the senior population. It's also why we have seen a tremendous drop in the number of deaths. Webster County, again, it's low general vaccine distribution, and they've only vaccinated 59% of their older folks. Robertson County, again, 28% of the older folks have been vaccinated. Our sister county, Boone County, 98% of those who are 65 years of age or older have been vaccinated, and the state average is 81%. So we're pretty close to the state averages on both total population and 65 years of age, but we're just a little under. We need to encourage everyone that we can to vaccinate. I know a lot of people have been vaccine hesitant because they don't believe there's been enough time to see what the outcomes are going to be. Now we're 6 months, almost going into our 7th month of vaccines, and any issues that have occurred with any of the vaccines have been very, 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 very extremely minor, to the point that anything that happened, you would probably see that happen in a normal population of people anyway. So next item, Jordan. So this is vaccines.gov, where you can find a provider. So if you don't know where to get vaccinated, go on vaccine.gov and it'll show you up to 47 providers around Daviess County. Let me remind you also that I think they said that we vaccinated about 40 people at Friday After 5 this past Friday, and there is going to be a mobile clinic at Friday After 5 this Friday. So if you haven't had an opportunity, pop down, get a shot, and you'll get a card, and 4 weeks later you get a call to come get another shot. Very simple and easy to do. And let me assure you that if you have transportation problems, call Grits 24 hours in advance. They will make sure that you get to your appointment. Next slide, Jordan. This is a hotline. This is where you can go to find a lot of really great information, state resources, kentuckycovid19.ky.gov. And there you can click on right at you'll see where it says view vaccine information, kind of in the orangish color. Well, right above it in the blue, right about in the middle of the page, you'll see where it says vaccines. You can hit that button and it will tell you anything and everything that you ever wanted to know about vaccines, including it will give you a interactive map where you can point to any county and it'll give you the population and it'll give you percentages of people who have been vaccinated in the various categories. Next item, Jordan. So the current vaccination priority is everybody 12 years old and older. And if you have any questions at all, I urge you to, number one, contact your medical provider. Number two, you certainly can call the Green River District Health Department, and they've got people who will help you. Or you can go to the Kentucky COVID-19.ky.gov website, and you can find a list of frequently asked questions, or dial the COVID-19 hotline, 800-722-5725, 800-722-5725, and they will help you answer. Next item. And this again is just telling you about the GRITS transportation service through Audubon Area Community Services. If you give them a call 24 hours ahead of time, set up an appointment, they will take you to and from your appointment to get the vaccine, and it is free of charge. Next item, Jordan. Everyone who qualifies for the vaccine and wants the vaccine should get it. No car, no computer, no problem. The Green River District Health Department will work with anyone. Go ahead, Jordan, next item. And this just talks about individuals contacting the health department. If you have an organization that would like to perhaps coordinate with the Green River Health District to bring a clinic to your church or to your business, then there is some information. If you call the 686-7747 number, extension 3030, then they will work with you and try to provide that service. Jordan, I think that's about all that you've got on there. So one of the things I want to do is just briefly again tell you that Daviess County has had 10,611 confirmed cases. We had ever in the hospital out of that was 352. Currently, we have 3 in the hospital. We've had 184 deaths. If you go down to the bottom what I'm looking at, there have been 22,285 cases confirmed in the Green River District Health area. 10 of them are currently in the hospital. 893 have ever been hospitalized, and we've had a total of 399 deaths. We've had 97 COVID cases in young people who were less than 1 year of age. 1,093 cases in our senior population that were over 80. And then it ranges all over the place. You know, I think you've heard me say all along that masks are important, and they are. I think what we're seeing is that vaccinations are even more important. Vaccinations save lives, vaccinations save illnesses, and vaccinations, by getting vaccinated, you're actually showing that you care for all those people who are around you. So with that being said, have a nice Memorial Day weekend. It's a long weekend. You know, celebrate with your family. If you don't know the vaccination status of people, wear a mask. I keep one in my pocket and I put it on. With that, I look forward to seeing each and every one of you around next Wednesday, June the 2nd, same time, same station. Thanks, and have a nice day.